In this segment, we're going to be covering AEDs. There's been some changes since 2002, and we're going to be going over some of those new 2005 guidelines and how they apply to you, the rescuer. Now, a couple differentiating facts here in regards to AEDs. You're going to be seeing some of them still out in the community and on floors potentially that have been actually programmed to still follow the 2002 guidelines. The 2005 guideline AEDs are those that are going to be released ever since January of 2005 or a little bit later. Both will do the same job in the end, but for all practical purposes, we're going to be using the 2005 guidelines with an AED trainer that's been programmed at those guidelines. So a couple things beyond that though, and I'll distinctly break those apart, is that there's two differentiating types of patients which are going to direct us on how we're going to apply the AED. If the patient is a witnessed arrest, we're going to go directly into burying the chest, placing the pads, turning on the AED, plugging it in, and going through the whole protocol of the AED defibrillation and the CPR. If it's an unwitnessed cardiac arrest, we're going to be doing CPR for 2 full minutes prior to applying the AED. For the sake of this training, the whole scenario is going to be based on a witnessed cardiac arrest to save a little more time as we demonstrate how to set up the AED, how to apply it, and then how to actually run an AED protocol. There are a couple things we're going to mention about setting up the scene and making sure the scene is safe. We want to make sure that there are no combustible liquids, no combustible gases, no standing water, no water under the patient or around the patient or touching the rescuer. Those would all be contraindications to using the AED until we could move the victim to another area, which would then be an actual safe area to be able to apply the AED protocol.